This video will demonstrate use of the MPR Improved Original Knee Leg Holder from Medical Products Resource. We will use the leg holder, the leg holder crossbar, and one of the many MPR options in leg holder inserts, or pads. You will also need a Clark socket, or the MPR all-in-one socket that accepts both round or blade posts. Note that this video will feature the easy-to-use all-in-one socket. Begin by preparing the patient's operative leg in the normal manner for your facility. Position an MPR all-in-one socket, which may be attached over the drape, on the table rail. Place the mounting post of the leg holder into the socket. Place the leg holder insert around the thigh, about 4 to 6 inches above the superior aspect of the patella. Once the leg and the foam insert are in the brackets of the leg holder, make sure the grooves on the sides and bottom of the insert are aligned with the framework. With the insert closely compressed around the leg, slowly place the crossbar through the appropriate hole on the framework and across the center of the foam insert, aligning the bar in the insert grooves if your pad has them along the top. Take care not to stab the insert with the crossbar. Be sure to choose the crossbar hole that is appropriate to patient leg size and will provide a snug fit. Note that the MPR 10200 leg holder has been improved from original designs so that the brackets can open 2 inches wider to accommodate larger legs, and either a standard or extra large pad. The crossbar that is included with the leg holder system is extra long and can span the wider opening as needed. Carefully tighten the brackets of the leg holder around the insert and thigh by grasping the T-bar and providing constant pulling tension. You will begin to see the frame close. When you achieve the desired tightness, hold the bar closer to the gearbox and push the lever down toward the floor to lock in place. This achieves a tourniquet effect around the leg. The patient is now ready for final prep and draping. You may choose to use a well leg holder. The MPR Mini Well Leg Holder is shown here. To release the leg holder, lift up on the gearbox lever and push the T-bar away from your body and toward the patient. When storing the leg holder, note that this model features an extra hole in the frame for convenient crossbar storage. In addition to the complete improved original leg holder system, MPR offers replacement crossbars and T-bars, as well as more than 20 options in pads, including standard and extra large, reusable, single-use, coated, firm, soft, economy, and more. Discover the difference these products can make. Contact us for free product trials or pad samples and to discuss your specific needs.